It's time to vote. Tired of talking about it.
If he's tired of talking about it, imagine how everybody else feels.
I endorse what the president just said. Top Line starts right now.
Hello and welcome to ABCNews.com's Top Line. I'm David Challenge.
And I'm Rick Klein.
Each weekday we're bringing you the very latest political headlines, reporting, insight, analysis, everything you need and want to know about politics.
And follow us via Twitter. It's @TheNote. Let us know what you think.
What is your top line today, sir?
End games. You have heard it before, but we really are reaching the end stages of healthcare negotiations. We're waiting on a score from the Congressional Budget Office, but House members are getting a readout today on what's actually in this bill. Once we get a bill, then we can count the noses, but we're in this kind of waiting game again. We know we're close, but just not how close.
We did get one CBO score today, and that was a revised CBO
Not the one
score
they were looking for.
of the Senate bill that passed December 24th. A little more expensive, a little less deficit reduction, but in the ballpark of where we thought we were, this $900 billion bill right now. Partisan reform. Yes, announcement today from Banking Chairman Chris Dodd, Democrat of Connecticut. He's going to go it alone. He's going to unveil his financial regulatory reform plan. This is something he's been working on with the Republican senator from Tennessee, Bob Corker, and Rick, as you know, these conversations are going to continue, but the idea, after all of this talk from the White House to call for bipartisanship, that they were trying to do this on this financial regulatory reform, which is popular with the public, that bipartisanship died here too, and now Chris Dodd has to go it alone.
And one of the things that Senator Corker is blaming is health care, because the timeline got so confused around all of that. We'll see if there's ultimately Republican support for what they finally produce. Glass houses, another day in ethics land. We have Republicans calling for further investigations of the Eric Massa episode, and Republicans also dealing with the fallout now of new allegations around Senator John Ensign. It is backing up Doug Hampton's side of the story that Senator Ensign helped set him up in business. Some emails reported by the New York Times. No one has clean hands in any of this.
No doubt about that. You know, Nancy Pelosi is supposed to have a weekly Thursday press conference. Got moved to Friday because she has nothing to say on healthcare yet. They're waiting for that score, but also because I'm sure they, in the absence of healthcare news, they didn't want to be bombarded with what did you know, when did you know it about Eric Massa. Number one, yes, that's where Mitt Romney is going to sit, at the top of the New York Times bestseller list for his new book, No Apology. When he hits the bestseller list on March 21st, he will debut at number one. A lot of people, Republicans and Democrats, are saying, I had no idea Mitt Romney had such a following. These things can be manipulated by the publishing industry a little bit. We'll see if he has staying power on the list. But 7 weeks of Game Change by Mark Halperin and John Heilman in the number one bestseller slot. Going Rogue was up there, Sarah Palin's book, for 6 weeks. Political books are being consumed right now.
Clearly, we're doing the wrong thing. We should get right.
We're going to begin with the healthcare debate that is totally engrossing everybody up on Capitol Hill. We're joined by Democratic Congresswoman Lynn Woolsey of California. She joins us up there on Capitol Hill. Congresswoman, let me begin. I believe the Democratic caucus today was getting a readout from the leadership about where this bill stands right now. There were reports that they got an initial CBO estimate. They're sending some things back. What have you learned from the leadership about when you expect to see the bill?
Sooner rather than later, but we're not going to see it until the House Democrats are satisfied with the reports we're hearing.
So what kind of reports are you talking about? Are you talking specifically about what you need to know from the Senate? What kind of assurances you need to know about from the Senate that can happen in the reconciliation bill?
We need to know what CBO is really saying. We don't have the CBO numbers, and we don't have the assurances we need from the Senate. You're right about both.
Congresswoman, there's been a lot talked about in the last 24 hours or so about the Rules Committee drafting a process whereby the House would just deem the Senate bill to have been passed and then move on to reconciliation. Is that something you'd be comfortable with, or would you prefer to see House members on record take an actual vote on the Senate legislation?
Well, what I want to see is what that reconciliation is, what the Senate is willing to support, and that before anything from the Senate is passed in the House. And I don't need to see my colleagues vote for the Senate bill in the House. We don't like the Senate bill. Why should we be forced to do that? But what we need to know before any Senate bill is passed, that we have enough of the fixes that we've asked for, that we will be satisfied with the final product as a beginning for health care.
Congresswoman, those fixes that you talk about may be immediately following, but it does mean you're going to have to cast a vote initially for the Cornhusker kickback, and you're going to have to cast a vote for a bill, even in the long run of this, that doesn't have a public option or it doesn't have all these things you want. You're going to be on record voting for some very unpopular things from your point of view, even though the fixes may come right behind. Are you going to? Are you worried about being sort of vulnerable to charges that you're voting for a bad bill in the end?
Well, the hardest part for me will be voting for a bill that does not have a public option. But I will reintroduce the public option legislation the day that the president signs this health care into law. We will be starting to fix it the day it's passed. The bit about passing and voting for the Senate bill, the American people are smarter than this. They know this is what we have to do if we're going to go forward. They're not going to blame me for that Senate bill unless I don't do something to fix it.
But it sounds like you'd be comfortable, though, with the procedural scenario where there wouldn't actually be another roll call vote on the Senate-passed legislation, that you'd say, okay, we deem that passed, and then we're going to move on now and deal with reconciliation package. Is that right?
I would be okay with that.
And take us a little bit into the understanding, again, inside of your caucus, for the members that voted no in November, your Democratic colleagues that voted no, what do you sense that leadership is saying to them, and how can you help them in this effort to talk to those folks and get them to vote yes this time?
Well, actually, unfortunately, some of them voted no because there was a public option in the House bill. They will not be against the bill when the public option is out. Others voted no because of the abortion language. So I think a lot of that is going to be fixed by the time we're voting on it again. And
Congressman, what is your message to your progressive colleagues as well as the progressive community who've invested a lot of hopes and expectations in this? They don't see a public option. There's some like Congressman Kucinich who are going to vote against this. You're going to be supporting this package. What is the message beyond we're going to keep fighting for this? Is this bill going to do enough good to kind of ease the concerns about what it's not doing?
Well, actually, Rick, it's not the message from me to my colleagues. It's the message from my constituents to me. You know, we wanted a single payer in my district. Then my district was very, very generous in understanding that the robust public option would do a lot. And now they're calling me saying, Congresswoman, I understand what you wanted, but we need to get started. Don't let the health care bill fail. And I don't hear anything else from my district but that. And you know, we get thousands of emails every single week, so it's not like I don't know what they're thinking. So,
Congresswoman, before we let you go, I want to just turn to this overall issue of the ethics cloud that sort of was hanging with Congressman Rangel having to step down as chair of Ways and Means, and Eric Massa resigning his seat in Congress. Are you concerned that after we saw Republicans go through this in 2006, that now Democrats are having in control now their own ethics issues, and that the country we know is just so anti-Washington right now that this feeds that fire in a way that's not helpful to your party?
Of course I'm concerned, and I don't blame the public for thinking, isn't it good enough to represent the number of constituents we represent, that we have to do things that are beyond that then get us in trouble. Shame on all of us for if we can't follow the rules. But yes, I worry about that. Not Democrats particularly, but all members of Congress.
What response would you like to see? What would you like to see Congress do to respond to this?
I would like to see Congress get money out of politics. And I can tell you, this health care debate would be 180 degrees different if there wasn't so much money riding on how you vote.
Wow. And speaking of money in politics, that raises another issue that has been very predominant this week, which is this battle over that Citizens United Supreme Court case about corporation donations and labor donations to candidates. You saw the White House pushback. You saw the president at the State of the Union push back at the Supreme Court on this. And then you saw John Roberts question whether or not the Supreme Court should even attend such a politically charged event as the State of the Union. And then you saw Robert Gibbs go after this decision again. Are we seeing a real battle of separation of powers here? And are you, do you believe that the White House is firmly in the right position on this?
Well, I certainly believe that the Supreme Court made a huge mistake in their decision, and and I also believe that nobody can say it doesn't matter who's appointed for life for a court position, because it is very political, and it wasn't supposed to be.
Great. Congresswoman Lynn Woolsey, Democrat of California, thank you so much for being here today. We greatly appreciate it.
Thanks for having me.
Let you go off and vote. We love it.
I have to go right now. We're voting.
Good, good, good.